I am Dr. Supreeth. As I am an Ayurvedic doctor, I am proud to call me as a Vaidya. I am Vaidya Supreeth. Soon after completion of my post-graduation, I had to come to my native place, that is Uppinangady in South Canada district, Karnataka state. And I met a person, that is Dr. K.G. Bhatt. Dr. K.G. Bhatt was a person of discipline. He taught me the ethics of medicine, like how a family physician must work, what things he has to see when you treat a person, and knowing the family history. Even the visits with a box, I used to cross the small rivulets and I used to go to the patients. As I was a MS in Ayurveda, I could do the catheter changes in the villages and all. Even declaration of deaths. It was a very challenging task in the initial days. I am a postgraduate in the department of Shalya, that is Ayurveda surgery. So we practice more of marma chikitsa here. That is, we deal with the patients who have low back aches, knee joint pain all over the body, age-related disorders, degenerative disorders, even patients of anorectal disorders like piles, fissure, fistulae. Ayurveda always tells that the swastha purusha, that is the health means samadosha samagnishcha samadhatu malakriya prasanna atma indriya mana swastha ityabhiti. Atma indriya mana. The World Health Organization defines health as it's not a mere absence of a disease. It's a complete state of physical, mental, social and spiritual well-being of a person. Here we are trying to give the holistic health. The tropical vegetation in the backyards of Balli Ayurgrama definitely adds to the oxygen concentration, which is conducive for their health. The rejuvenation is seen even all the cells of the body. Treatment reaches each and every cell of the body. Most of the patients come here for getting relief from their physical ailments. They definitely get relieved by the Ayurvedic treatment modalities and the culinary treatments, marma chikitsa, which we give here in Ayurgrama. Ayurvedic diet we give, and we give customized diets to the patients. We grow our own organic vegetables, and milk is used from our own Goshala to the Balli Ayurgrama. I was brought up with nature, I can tell. My forefathers were agriculturists. We are the 6th generation people known to be living since 6 to 7 generations. So when we were small, we used to do all the works of the cows. We used to work in the fields, in the farms. The thought came that why I can't do a hospital, which it must not be like a hospital. The treatment must go on in the lap of the nature. Patient must not feel they are in the hospital setup, because Ayurveda hospital and allopathy hospital need not be same. That thought came to my mind. That is why the thought of starting Ayurgrama came to my mind. Ethno-medicine is the field of interest. It's my favorite subject now, because there are a lot of wonderful herbs. It's told that in our samhitas, nahi kinchit anoshadam jagatam anoshadam kinchit. That is, each and every plant, though it is a weed, it has some medicinal properties in it. I started curiosity in such drugs and started to give some of these drugs to our patients. I used to get wonderful results, more than these patent medicines. Kalari and Panchakarma, Marma Chikitsa treatments, we started to use our own oil. Mostly we are using our own medicines grown in our farms. Then I added organic vegetables. We have a Goshala, that is Kapila Goshala, Balli Goshala, which contains the indigenous breeds. In Ayurveda, there is a concept called Idam Desham, Idam Kalam. The specific breeds or the food which is grown in that particular area is better for the particular people of that area, geographical area. The concept of Balli Ayurgrama is developed on the principles of Indian Vaastu Shaastra. The building looks as if it has bloomed out of the earth. It's built with the red laterite, which are normally used for the construction of temples. We have constructed the building following the principles of Indian Vaastu Shaastra. In the center there is a courtyard with 4 blocks on the 4 sides. The periphery is designed initially. There won't be any add-ons later. Basically, this land is a humid area And because of this Chathushala construction, we are not using any AC, air conditioner in our building. Normally, we treat patients of us are of musculoskeletal disorders with low back aches, knee joint pains, all the fibromyalgia patients. Because of the stress, they'll be having pain all over their body. Those who want to be stress free in their busy life, I think this yoga, ayurveda, jyotisha, all these things, when we give comprehensively to a patient, definitely we get the best results. When we club our systems, definitely we can give wonderful results. We have calorie massiers who are well versed in calorie marma chikitsa. When they do the treatments for the IVDP patients, like it's a type of chiropractic which is done in the West. We have a martial art, that is Kalaripayattu. In that such rituals like treatments we do here. After these treatments, if we do yoga in the evenings or some specific exercises for their low back ache or maybe for their joint pains, if we do club yoga, we have seen excellent results in our patients. For PhD, my subject is Agni Karma, that is in osteoarthritis, we'll be doing cauterization for relieving the pain. Because knee joint pain is a common prevalent disease in among the old age. After 60, almost 80 to 90% people will have this problem. That's why I have selected this topic for my PhD. In other systems of medicine, the analgesics are we have to take for the long time. Otherwise, knee replacement has to be done. But in Agni Karma, it's a one-time treatment. When you do the procedure, it's a heat cauterization. I have done with a golden tipped probe. When you do that, the pain will be subsided almost for 6 to 1 year. The pain won't recur. So at least you can avoid using the analgesics which have the side effects on your kidneys or other vital organs of your body. When we do this treatment, the Agni Karma treatment, it's affordable to even a common man. Any person can, not only for knee joint pain. Agni Karma can be exclusively used for all types of pains. Maybe if for the low back ache or even the calcaneal spur, when there is pain in the calcaneum, that is calcaneal spur, or plantar fasciitis. In such conditions also Agni Karma gives a very good result.